Normally, the epitrochlear node is not palpable. Repeat the procedure on the other arm.
Okay, great. Now I'm going to check the arteries in your hand.
Finally, perform the modified Allen test to assess radial and ulnar artery patency with the person's palms up. Compress the ulnar and radial arteries of one hand and have the person make a fist several times. His palm should blanch. While keeping the arteries compressed, have him open his hand. Then release the ulnar artery only. The hand should turn pink in 2 to 5 seconds.
Okay, great, Mr. Malik. I'm going to have you lie down now so I can examine your legs.
To examine the person's legs, have him lie down and drape his genitalia while exposing his legs. Then inspect both legs, noting skin color, size, including swelling or atrophy, hair distribution, venous pattern, and any lesions or ulcers. The leg color should match the rest of the body, and the legs should be symmetrical and evenly covered with hair, and have a flat, barely visible venous pattern with no lesions. In an older person, you may see trophic changes, such as thin, shiny skin, thick ridged nails, and hair loss on the lower legs. These changes are usually caused by arterial insufficiency, but can also result from normal aging.
Okay, I'm going to take a look at your legs now.
Diabetes mellitus is common among blacks, Hispanics, Native Americans, Aboriginals, and obese individuals. In these people, be especially alert for leg vessel changes caused by diabetes, such as coolness, pallor, diminished pulses, thin, shiny skin, and foot ulcers.
Great, I'm going to have you bend each leg slightly.
If the lower legs look asymmetrical, measure the calf circumference with a tape measure held at the widest point in the same place on each leg. The measurements should be within 1 centimeter of each other. During palpation, assess the skin temperature, comparing symmetrical spots. The skin should feel warm and equal bilaterally. Now test for calf tenderness by flexing the person's knee and gently pressing his calf muscle against the tibia.
Now, does this hurt or feel tender?
No.
This maneuver should cause no tenderness.
And how about this one?
No.
Great.
Then palpate the inguinal lymph nodes.
Okay, Mr. Malik, I'm just going to feel the lymph nodes in your groin now.
Okay.
If palpable, the nodes should be 1 centimeter or less, movable and non-tender. Next, palpate the peripheral arteries, starting with the femoral pulse. With your fingers just below the inguinal ligament, halfway between the pubis and anterior superior iliac spine, press firmly and then release slowly. If the femoral pulse is difficult to find, such as in an obese person, ask him to bend his knee to the side in a frog-like position. Next, assess the popliteal pulse. With the person's leg extended and relaxed, anchor your thumbs on his knee. Then curl your fingers around behind it and press the artery against the bone. Usually, the pulse is just lateral to the medial tendon. If you have difficulty finding the popliteal pulse, turn the person over.
Have you bend the one leg just a little bit?
Lift his lower leg and rest it against your arm. Then press deeply into the popliteal fossa with both thumbs.
Okay, Mr. Malik, I'm going to have you lie on your back again.
Okay.
For the posterior tibial pulse, Curve your fingers around the medial malleolus and press gently. You should feel the pulse in the groove between the malleolus and Achilles tendon. If not, have the person dorsiflex his foot to make the pulse more accessible. For the dorsalis pedis pulse, lightly palpate just lateral to the extensor tendon of the big toe. Remember to palpate the posterior tibial and dorsalis pedis pulses on the opposite foot. All pulses should feel regular, 2+ in amplitude, and symmetrical bilaterally.
Okay, great. Now I'm just going to check for swelling, okay?
Next, check for pretibial edema. Firmly depress the skin over the tibia or medial malleolus for 5 seconds and then release it. Normally, your finger should leave no indentations or pits. In a pregnant woman, you may see diffuse bilateral pitting edema, especially at the end of the day and in the 3rd trimester. Although this woman doesn't have varicose veins, you may also see them, especially in a multiparous woman.